Hello. The last time we met, we talked about weight-based calculations. There was a question on the last slide that I wanted you to try out. Today, I'm going to walk you through how to solve that question. So, let's begin. We had a question that stated the provider has prescribed digoxin 4 micrograms per kilogram orally twice a day. The client weighs 11 pounds. The safe range for this medication is 8 micrograms per kilogram per day to 10 micrograms per kilogram per day. What is the safe dose range per day for this medication? So, first of all, let's begin by converting our weight from pounds to kilograms. We know that in every 1 kilogram of weight, this is equivalent to 2.2 pounds. And the weight of this particular patient is 11 pounds. So this will be 11 over 1. Pounds will cancel pounds, and now we have 11 divided by 2.2, which is 5 kilograms. So this is the weight for our patient. Now that we know the weight, we can calculate for the safe dose range by multiplying this by the range that has been given to us. So what was the range that was given? We said that this medication's safe range is 8 micrograms, so 8 mcg per kilogram per day to 10 micrograms per kilogram per day. So what we are going to do is we will take this weight that we have in kilogram and multiply it by the lower limit for the safe dose range and the upper limit of the safe dose range. So we have the lower safe dose range, which will be equal to 5 kilograms times 8 micrograms. This is over kilogram over day because it says per kilogram per day. So kilogram will cancel kilogram, and we have 5 times 8 micrograms, which is going to be 40 mcg per day. Then we will take 5 again, 5 kilograms, and multiply it by the upper limit of the safe dose range. So we have 5 times 10 micrograms per kilogram per day. And this will give us 50 micrograms per day. So the safe dose range is going to be now, let me do this again, is going to be 40 to 50 micrograms per day for this particular patient. and this will be our safe dose range. Now that we know the safe dose range, is the prescribed dose safe? So now let's calculate the prescribed dose. Remember that our prescribed dose is 4 micrograms per kilogram per dose. Note that our safe therapeutic range is per day, and our ordered dose is per dose. So we have to ask ourselves, how many times are we giving this medication to the patient? And it says twice a day. Okay, so we know that in each day we are going to give this dose twice. And so we can just simply multiply this by 2 doses per day, and this will give us 8 micrograms per kilogram per day, because dose will cancel dose, and then we'll have microgram per kilogram per day. So this is our daily dose. Now let's see if this dose is safe. So to find the daily dose, we will just multiply the client's weight, which is 5 kilograms, by our daily dose. And so we have 5 times 8 micrograms per kilogram per day. So kilogram will cancel kilogram, and we have 40 micrograms per day. Now let's compare this to our safe dose range, which is 40 to 50. And then ask ourselves, is this daily dose greater than the upper limit of this safe dose range? If the answer is yes, then that is not safe. If it is no, then it is safe. So 40 is less than 50, and so 40 micrograms per day for this client is going to be a safe dose. So our answer will be yes, it is safe. Okay. Now, let's ask ourselves, is this dose therapeutic? For it to be therapeutic, remember, it has to meet the minimum threshold to elicit a response. And so for this patient or client, we said the minimum required dose for this medication to be therapeutic is 40 micrograms per day. And our daily dose, when we calculated, is 40 micrograms per day. And so this is also going to be therapeutic. So we will say yes, this medication is therapeutic. Now that we know that our medication is both safe and therapeutic, let's go ahead and see how many mLs we need to administer to the client. So to do this, let's begin once again by calculating our daily dose. We already know that this patient weighs 5 kilograms. Our ordered dose is 4 micrograms per kilogram per dose. So kilogram will cancel kilogram, and we have 20 micrograms per dose. So remember, we had to multiply our dose by 2 to get the daily dose. And so you can also do it this way: calculate the per dose first and then multiply by the number of times to get the daily dose. Or you can just go ahead and do it as we did it on the previous slide. Okay, so we have 20 micrograms per dose. This is our ordered dose or prescribed dose. We have a medication that is 1 milligram per 10 ml. That means we will have to convert this microgram to milligram. So let's use the dimensional analysis. We have 20 micrograms, but we know that in each milligram, okay, we have 1,000 micrograms. So microgram will cancel microgram. And then what we have is medication that is 10 ml in each milligram. So milligram will cancel milligram, and our final answer is going to be in mLs. Let's cancel some zeros, which will make our equation much more simpler. And now we have 2 divided by 10. And so our answer is going to be 0.2 ml. So this is what the nurse should administer to the client per each dose, 0.2 ml. So to recap, we noted that our safe dose range was 40 to 50 micrograms per day. The prescribed dose was 40 micrograms per day, or we can say divided by 2, this is also 20 micrograms per dose based off the client's weight. 40 micrograms per day was less than the higher end of the safe dose range, and so that was considered safe. It was also therapeutic because it met the minimum or the lower limit of the dose range for it to be therapeutic. And then our dose that we had to give to this patient was 0.2 mLs. So thank you. Highly hopeful that you got this question correctly resolved. I'll see you on the next presentation. Take care.